Okay, I'm talking about thoracic vertebrae. This is a thoracic spine. I have folded it into a bunch. So this is basically your, what is this? Thoracic vertebrae. Whole thoracic spine has been collected into this garland, articulated with each other. Okay, 12 vertebrae are there. So we know there are 12 thoracic vertebrae, and what are the important features. So before going into vertebrae, we'll have to talk about, okay, we'll come to this. Okay, so let's talk about the thoracic spine. You can see the 12 vertebrae, they are arranged in the thoracic spine. So one thing that you can notice here, it is very clear, is that the vertebrae, they start becoming narrower and narrower as you go downwards, and also they start becoming taller. Okay, if you notice that, they start becoming narrower and taller, so it kind of tapers downwards, but it is also taller. It's the body start getting bigger because the body weight starts acting on the vertebrae below. Okay, so the vertebra tends to become much larger as you go downwards. So even in this you can see, so this is the first vertebra T1, and this is the 12th vertebra T12. So you can see the obvious differences. Okay, so the first and the 12th vertebrae, the differences are obvious. Like in the first one, the body is very small, and in the 12th thoracic vertebrae, the body is huge, like a lumbar vertebrae. Okay, so these things I'll have to demonstrate it later in another class. What is the difference between the different types of vertebrae? Okay, so the thoracic, the cervical, lumbar, sacral, all these vertebrae, they have some features which are common to themselves, and there are certain things which differentiate them from the other vertebrae. Like the thoracic vertebrae, to differentiate from the cervical and the lumbar vertebrae, there are certain techniques. Okay, we'll talk about them. So you can see there are 12 thoracic vertebrae, and unique thing about the thoracic vertebrae is that the ribs are attached to the thoracic vertebrae. You can see in the spine, only in the thoracic spine you will see the ribs. Okay, in the cervical and lumbar part, there is something called the costal element. We'll not talk about this here. This is far beyond your scope. The ribs which make up the thoracic cage. Okay, the 12 pairs of ribs, they are attached to the thoracic vertebrae, of course. Right? Okay, so this is unique about the thoracic vertebrae is that they have the attachment for the ribs. That's one point. There are several other points. We'll talk about them. Not today, maybe, but some other day. Okay, so the lumbar spine you see in contrast. Okay, there are 5 vertebrae. We'll not go into the details. Okay, so below the thoracic you see the lumbar, and the obvious difference is that the vertebrae, they are much taller. The thoracic vertebrae in the upper part it is short, but in the lower part it is tall, and the lumbar vertebrae, all of them are taller. Okay, and there are no ribs obviously. Okay, so there are certain bony structures, and in the spine, you know the bony structures are the vertebrae. There is the intervertebral disc, and there are the ligaments and the joints. Together, all of these make up the spine. Okay, so the bony structures here you can see, all vertebrae will have something called the body. Okay, so this part which has been marked in green is called the body of the vertebra. So the vertebrae, they have different parts. Okay, so this part is called the body of the vertebra. Okay, the huge this thing is called the body. Okay, so here this is the thoracic vertebra. Obviously, you can see the rib is being attached here. So the ribs, they have 2 points where it is attached. Actually, 3 points. We'll come to that. But it's attached to the body of the vertebrae here, and it is also attached to the tip of the transverse process. Okay, on 2 points, the ribs are attached to the thoracic vertebrae. Okay, and the posterior part is called the vertebral arch. Okay, so this part, if you like, this green part is the body, right? And the whole of the rest of the part, like this whole entire thing, is called the arch or the vertebral arch. Okay, so in the vertebral arch we have something called pedicle and something called lamina. Okay, so this part is called the pedicle. The pedicle is the part of the vertebral arch which is attached to the body of the vertebrae. Okay, so this part is called the pedicle. Okay, so in the vertebrae you can see the pedicles. You have to look at it closely. Okay, while you handle it, you have to understand which are the pedicles. And these two parts, one on either side of the midline, are called lamina. The two lamina, they fuse together in the midline. Okay, so there is one lamina on the left side, one on the right side. The two lamina, they actually extend from the pedicles. Okay, so these are the two pedicles, and these are the two lamina. These lamina, they extend from the pedicles towards the center, and they will meet at the midline to complete the vertebral arch. So this entire thing is the vertebral arch. and the vertebral arch and the body of the vertebra together, they form a canal. As you can see, in front we have the body, and on the sides and posteriorly we have the arch. So this entire thing is called the foramen that it creates is called the vertebral canal. Okay, so the body is here, and the arch again has two parts: the pedicles and the lamina. Okay, so again, these are the pedicles. See here the pedicles of the thoracic vertebra, and these are the pedicles of the lumbar vertebra. Don't pay attention to the lumbar vertebra now. Okay. Okay, so these are the lamina, and this part is the intervertebral disc. Here they have shown the intervertebral disc. This intervertebral disc has two parts, right? So annulus fibrosus and the nucleus pulposus. So this part is the intervertebral disc. So the intervertebral disc it intervenes between the body of the vertebrae. Okay, so as you can see, so these are the processes. Okay, so in the midline the lamina they fuse. Okay, and posterior to the fusion of the lamina you have an extension on a process which extends posteriorly and downwards. Actually, it is not just posterior, it goes posteriorly and also it goes downwards. Okay, so posterior inferiorly, this is called the thoracic spine. Okay, and in comparison these are the lumbar spines. Okay, so the thoracic spines are actually very long and triangular. You have to look at the vertebrae to understand that they are long and triangular, whereas the lumbar spines they are broad and square. Okay, so in the lumbar you can see these the spines they are very huge, and they are broad and they are square because very large muscles which maintain your weight. I mean upright posture and carry your weight. They are attached to these lumbar spines. Of course, they are attached to thoracic spines also, but there you have the ribs and all the intervertebral muscles and all those things which help. But in the lumbar region, it's only the muscles at the back which has to like support your weight in front. Okay, so as a result, the whole lumbar spines they become a huge structure and gives attachment to so many different muscles. Okay, then there are the transverse processes as you can see here. So these transverse processes in the thoracic vertebrae they are very large. Here you can see in comparison the lumbar transverse processes are not very not very large like the thoracic vertebrae. They are present and they are very slender. But the thoracic vertebrae, the transverse processes, they are very stout, very thick. This is because they give attachment to the ribs. Okay, so they give attachment to the ribs on 2 points. I told you one on the body and one on the transverse process. So in the transverse process, they give attachment to the ribs here. Okay. Okay. Here again, these are the transverse processes of the lumbar vertebra, but the transverse processes lumbar vertebra are sometimes called costal processes. We'll not go into why it is called like that. Okay, just remember there are transverse processes in all the vertebrae, and the thoracic transverse processes are very large because they give attachment to the ribs. Okay. Okay, so these are again superior articular process. So here see this is the thoracic vertebrae in the lateral view. You see this is the superior articular facet. So similarly this is the inferior articular facet down. Okay, it has several facets, right? So these are the superior articular facet, these are the inferior articular facet, and this gap here, okay, this gap is when the two thoracic vertebrae they articulate with each other, this gap would form actually the intervertebral foramen. Let me see if I can show you somewhere. Okay, here we can see in the lumbar vertebra, right? So this is a facet here. I mean this gap, and this gap is corresponding gap on the superior surface of the vertebra below. These two they will unite together and form the intervertebral foramen. Okay, so this is the vertebral canal and this is the intervertebral foramen. So in the vertebral canal you will have the mainly the spinal cord, which is meninges and all so many other structures. From here the spinal nerves will come out. Okay, so they need some gap to come out of the vertebral canal, and this is the gap through which it comes out. Okay, so this gap is formed by the articulation of the vertebra, half by the vertebra above and half by the vertebra below. Okay, so this is another diagram where you can see that. Okay. Okay, so this is the superior articular facet, this is the inferior articular facet. Now you see how many facets are there in a thoracic vertebra. Okay, so you see there is one facet above, one facet below. Both of them give attachment to ribs. How? So this facet it gives attachment to the corresponding rib, and this facet it gives attachment to the one rib one number below. That means if this is the fourth thoracic vertebra, this superior facet will give attachment to the fourth rib, and this small facet below will give attachment to the fifth rib. Okay, so that means at the body, if you articulate the fourth and the fifth rib together, the fourth and the fifth vertebra together, then the small facet above on the fifth and the small facet below on the fourth, together they will complete the entire process. That means each rib on the vertebral body, it articulates with two ribs together. Okay, so it will, when two vertebrae articulate with each other, okay, superior and inferior, then they will complete the facet, and each rib will actually attach to two vertebrae. The head of the rib will attach to the vertebrae corresponding to it. Okay, suppose this is the fourth vertebrae, then the fourth rib will be attached here, but the third vertebrae will also provide a little bit of attachment to the same rib. Okay, so this is how the superior articular facets they are present. So they actually face posteriorly and laterally. Okay, and the corresponding inferior articular facets will similarly they will have to face anteriorly but medially, so that it can articulate with the facets above, right? Okay, so this is inferior articular facets, right? Okay, they have to face forward and medially to be articulated with the superior articular facets. Okay, now coming to this vertebral foramen. So I told you the vertebral foramen, this part, it contains the spinal cord, meninges, and all the structures, right? So this is the body of the vertebrae above. Posteriorly, you have the vertebral arch. So you have the pedicles and the lamina. So pedicle, lamina, and the body of the vertebra together, they will complete the vertebral canal. Okay, so also called the vertebral foramen. Actually, for a single vertebra, this is the vertebral foramen, and when all the vertebrae they will articulate, then the vertebral canal is completed through the spinal cord. And this is the intervertebral foramen. Like I told you, the the gap here present on the inferior surface of the pedicle and the superior surface of the pedicle of the lower vertebra, the two will come together, and they will form the intervertebral foramen, and this intervertebral foramen will provide a passageway for the nerves to come out of the vertebral canal. So the costal articular facets, so these are the costal facets, okay, on the body. So this is typically present only on the thoracic vertebrae. These are not present in the lumbar, these are not present in the cervical vertebrae. Okay, so this is one point by which we can identify the thoracic vertebrae, is that the presence of costal facets. Okay, so there are actually two on each vertebrae. One is the superior articular facet or the superior costal facet, and the inferior costal facet. Okay, the superior costal facet, it gives attachment to the corresponding rib, and the inferior articular facet, it gives attachment to the rib one level below. Okay, and obviously this is the head of the ribs. Okay, so this is the superior and this is the inferior. As you can see, the superior articular facet is bigger, so this is for the corresponding rib, and the inferior articular facet is much smaller. These are actually called demifacets. Okay, demifacets means these are half. Okay, suppose this is the fourth vertebrae, then this one will give attachment to the fifth, but the fifth vertebrae will give most of the attachment to the fifth rib. So together they will complete the articular facet. Okay, so this is half, and the half is there below. Okay, now there is another articular facet on the tip of the transverse process. Okay, so this is the again for the articulation of the rib. Which part of the rib? The tubercle of the rib. Okay, so when we do the class on ribs, you will know the different parts: head of the rib, the tubercle of the rib, neck of the rib, all these things. Okay, so the head of the rib articulates with the vertebral body, and the neck of the rib articulates with the tip of the transverse process. Okay, different names are there, so many different fovea, costalis, processus, transversi. No need to go into so much of a complicated name. Okay, so just remember the facet at the tip of the transverse process. Okay, now there is one thing: T11 and T12, they have no articular facet on the transverse process, which means what? Suppose, let's go back to the first diagram. Okay, so here the T11 and the T12, they don't articulate with the transverse process of the thoracic vertebrae. Okay, the 11th and the 12th rib, they just articulate with the body. The head of the ribs, they articulate with the body of the vertebrae, but the tip of the transverse process give no articulation to the 11th and the 12th rib. Okay, so now let's come to this thing, intervertebral disc. So this is the intervertebral disc. Okay, so outer, this intervenes between the body of the vertebrae. Okay, so the outer part is called the annulus fibrosus and the central part is called the nucleus pulposus. Okay, so the outer part again it has multiple layers. Okay, this develops in layers and the central part is actually a jelly like substance. This is said to be a remnant of the notochord. I think by now you know what is a notochord. Okay, so this is the structure just like the layers of an onion. Okay, so this is how the fibers are arranged in concentric rings, and in the center you have the nucleus. Okay, I told you this is a remnant of notochord. So what are the ligaments? So the different joints, one is this one between the superior articular facet and the inferior articular facet. This is also called zygapophyseal joint. This is actually a synovial joint. Okay, then there is a ligament called the intertransverse ligament. Okay, so this ligament is present between the transverse processes of two vertebrae. Okay, suppose this is L1, L2, so this is one transverse intertransverse ligament. If this is T11, T12 and this is L1, then this is another. Okay, so in between all transverse processes, the tip of the transverse processes, it gives attachment to the intertransverse ligaments. Now there is something called ligamentum flavum. So this here you can see ligamentum flavum is present here. Ligamentum flavum is actually a ligament which is attached, which is present on the posterior surface of the vertebral canal. So this is the body. These are the pedicles which have been cut. Okay, these are the lamina. So on the lamina you see this is the ligamentum flavum. Okay, so this is composed of elastic fibers. Okay, so while doing lumbar puncture, this is one of the things that you have to pierce. This is the ligamentum flavum. Okay, again then there is something called interspinous ligament. So just like there is intertransverse ligament, there is also interspinous ligament. So the intertransverse ligament is between the transverse processes and the interspinous ligament is between the spinous processes. Okay, now again there are two more ligaments called anterior and the posterior longitudinal ligaments. So these are attached to the body of the vertebrae. Okay, so the anterior longitudinal ligament is attached here on the anterior surface of the body of the vertebrae, and the posterior longitudinal ligament is attached on the posterior surface of the body of the vertebrae. Okay, so the anterior longitudinal ligaments and the posterior longitudinal ligaments. Okay, this is another view. Here you can see this is the anterior longitudinal ligament, this is the posterior longitudinal ligament, and this yellow structure is the, what is this? This is the ligamentum flavum. Okay. Okay. So again there is something called supraspinous ligament. So this ligament it is attached continuously to the tip of the transverse processes. Okay, so see this is the continuous structure. So contrast this with the interspinous ligament. See, interspinous ligament is interrupted. Okay, there is one ligament for each segment. Okay, so suppose this is T11, this I mean L2, this is L3. There will be one interspinous ligament here. If suppose this is T12 and this is L1, there will be one interspinous ligament here like that. Okay, but the supraspinous ligament, you see, this is a continuous structure. It is attached all along the tip of the entire vertebral column, almost the entire vertebral column. Okay, so this is the supraspinous ligament. So in the spine you have two ligaments, supraspinous and the interspinous. So that's it about the theory. So let's see the ribs. So this is mostly you have to know about the different parts of the ribs mainly. Okay, so you have the body, you have the pedicles, the lamina, transverse process and the spinous process. And what you have to remember is that the vertebrae in the thoracic region, the vertebrae they have costal facets, and the costal facets they will provide articulation to the ribs. Okay, in the body they will provide articulation to the head of the ribs, and in the tip of the transverse process it will provide articulation to the costal tubercle. Okay, so this one is the typical thoracic vertebra. You can see the body here, right? So this is the body. So this part is the body. This one is the pedicle. Okay, so this is the pedicle by which it is attached. Then you have the lamina. So you can see the two lamina on either side. This is one lamina, this is the other lamina. The two lamina they will be meeting in the middle to complete the vertebral arch. So this is the body and this whole thing is the vertebral arch. Okay, these are the two transverse processes. This is one transverse process, this is another transverse process. Okay, so this is a thoracic vertebra. How do we know? You have to look at it from the lateral side. You see there are the articular facets. This is the superior articular facet and here you have the inferior articular facet. Okay, so this here pedicle is very clear and this is the gap. Okay, so when two vertebrae they unite, when they articulate, you see this is completed. So as this is completed, this here is the intervertebral foramen. Okay, this is the vertebral canal. Of course, this is the vertebral canal. Okay, and this one is the intervertebral foramen from which the uh, nerves will come out. Okay, I told you there are two facets, one on the superior surface, a superior part. Okay, this is the superior articular facet, this is the inferior articular facet. Okay, now this also is a superior articular facet, right? So for example, let us say that this one is the fourth thoracic vertebra and this is the fifth thoracic vertebra. So where will be the fourth rib be attached? Fourth rib will be attached here. And where will be the fifth rib be attached? It will be attached like this. Okay, it will be attached to both these facets like this here in this part. Okay, so that the two facets together it will give articulation to the head of the ribs. Okay, and if you look at the transverse process, this is the transverse process. Like I told you, there is another articular facet here. Okay, and this articular facet it will give attachment to the tubercle. I mean, near the tubercle there is another facet on the rib. We'll talk about that when we are doing the class on ribs. Okay, so that's for the articulation of the angle of the rib. Okay, now when we go down, this is the almost 11th or 12th thoracic vertebrae. You can see there is only one facet. There is no facet below, right? So there is only one facet. On the, remember that the first T1, the T11 and T12, these three vertebrae, they have only one facet. They don't have two facets like the others. So these are called atypical thoracic vertebrae. The rest of them, they are called typical thoracic vertebrae. Okay. So if this is the 11th thoracic vertebrae, this will give only attachment to the 11th rib. It will not give attachment to the 12th rib. Okay. Similar for the T12, also for the first thoracic vertebra. So to T1, T11 and T12, they have only one facet on their body. So these three are the atypical thoracic vertebrae. But the rest of them, they are typical. And as you can see, this is the 12th thoracic vertebrae. Can you see the difference in the spine? There are so many differences. You can note, this is a thoracic vertebra by the means of the costal facet present on the body. But what are the differences? See, look at the differences in the spine. You can see, right? So this one has a long and slender and thin spine. Okay, and the typical one. This is almost like a lumbar spine. Thick, broad, and very tough. Okay, so this is a lumbar spine actually, a lumbar type of spine. But the typical thoracic vertebra, they have a long, slender spine. So as you go down towards the 11th and 12th rib, the spine becomes like a lumbar vertebrae. Okay, but this is a thoracic vertebrae. Why? Because we know this is a thoracic vertebrae because it has the presence of a costal facet on the body. Okay, but you see there is no facet on the transverse process. I told you, if this is the 11th rib, for example, it will be attached only to the body. It will not be attached to the transverse process. Okay, but if it is the, let's say, 4th or 5th rib, then it will be attached in 2 points. One point of attachment will be on the body, and the second point of attachment will be on the tip of the transverse process. Okay, now yeah, I told you this is the body. So here, anterior surface, here this part will be the attachment for the anterior longitudinal ligament, posterior surface of the body for the posterior longitudinal ligament, and this point is for the attachment of this point here. It is for the attachment of the ligamentum flavum. Here you'll have the attachment of the interspinous ligament. Okay, in the between the transverse process. Intertransverse ligament. This one here is the interspinous ligament, and like this, at the tip of the spinous process is the supraspinous ligament. Okay, so that's it. You understand the differences, and you can see that another difference is the size of the body. Okay, so a typical vertebra, the body is very small, but going down as you go towards the lumbar side, 11th and 12th thoracic vertebrae, their body becomes very huge. Okay, because they become large because they have to bear the body weight. Okay, so much force is exerted upon the lumbar vertebrae. I mean the lower thoracic and the lumbar vertebrae. So the body has to become very large. You can see that the spinous processes are short, but here it is huge. Okay, but sorry, transverse processes are short here. These are the differences actually. Okay, and here you can see the spinous processes. This one is long, slender, and this one is tough, thick. Okay, so that's it. Thank you.